Behind me is a scenario, a nursing scenario of alternate time and dimension beyond sight and sound, where rewinding occurs. You have entered the nursing zone.
Hi, I'm Corey. I'm going to be your nurse.
Hi.
Can you give me your name and your birthday real quick?
Stacy Signs, 11/13/74.
Awesome. And what seems to be the problem today?
I'm fine. I just have the flu.
No, she's been coughing all day and night. She doesn't even sleep. And she doesn't want to eat because her food tastes funny and she doesn't weight. Something's wrong.
Because I have the flu.
No.
What kind of medications are you taking, Stacy?
She takes lisinopril for hypertension.
Okay. Well, you think you have the flu, so let's do your vitals here real quick. I keep wanting to put that up, but I actually want to just take your pulse real quick. You said the cough's been going on for a while?
Yeah, it's been a while.
Is it this
Doesn't even
cough,
let me
or
sleep.
were you getting stuff out after before? I'm going to listen to your lungs. Take a deep breath. Okay. Have you been feeling any weakness or any problems with your heart? Skipping a beat or
Just
pounding?
cough.
Just a cough?
Yeah.
Okay, well, your vitals seem to be normal. Your temperature is normal. So, I'm going to have the doctor come in and take a look at you here real quick, okay? Should be in momentarily.
Hi, I'm Crystal, Dr. Messenger.
Hi.
And I'm today. Stacy, is it? So it looks like you have the flu. Is that right? I don't think she has a lot of coughing. Okay.
I can talk, you know.
Okay. Well, let's just take a look at your throat. Okay. So it goes right there. And you're not having any difficulties breathing, right? Okay. We're gonna go ahead and try you on some Tylenol with codeine. What's that for? What does she need that for? I don't think she needs any more medications.
It's for a cough.
Is it gonna make her tired? Because she has to work.
And I'm gonna write this prescription out. I'm gonna give this to Corey, and he's gonna explain it to you, okay? And answer any questions you have.
This is a common prescription that they give for flu with the cough. So this should help you out. And the Walgreens right down the street is open, so they can help you out.
Well, I really don't think she needs any more medicine. The doctor was only in here for a minute. That's ridiculous.
What is wrong with this scenario in a patient-centered nursing environment? It is time for a rewind in the nursing zone.
Okay, so I'm gonna write you that prescription for the Tylenol with codeine. 15 milligrams every 6 hours.
What is that for? Do we need any more medicine?
I'm gonna give this to Corey. Corey is going to answer the questions that you might have, okay? And we'll see you back in 2 weeks. Okay?
So this is a common medicine that they give for the flu, and it will help with your cough.
I don't think that medicine's gonna help. I don't even think she has the flu. She hasn't had a fever.
You had the fever. What else? What you're
She's
very
always
adamant about the
coughing. Her
flu.
I don't think she has the flu. She hasn't had any fevers. Her cough is dry and it's just there, nagging. She doesn't sleep. Her food
How long
tastes
has she
funny.
had the cough again?
It's been a while. It's been a few weeks.
Okay, you don't have the fever. You're right. The temperature was normal, and you're also saying that you're not eating, right? And how long has that been going on? Same.
Same.
Okay. You know, I'm wondering. You said you have hypertension and you're taking lisinopril. That actually can have a side effect of causing a cough and making it so that you don't want to eat. It causes taste disturbance, makes it so food doesn't taste right.
Yeah, now that I think about it, it's kind of around that time that yeah, when she started taking that med.
Okay, well, let's have the doctor come back in. I'm going to page the doctor real quick, and we'll see what we can do.
Thank you, Dr. Messenger.
Yes,
Dr. Messenger, thanks for coming back. We have a real concern here about not wanting to take more an additional medication. Also, the cough is not like a flu cough. It's very non-productive. She does not have a fever. She's having taste disturbances. It's not that she doesn't want to eat. It's that the food isn't actually tasting right. Not really seeing signs and symptoms of flu. However, she is taking lisinopril, which can cause the cough and the taste disturbances. So rather than giving them additional medication, I recommend that we change them over to a Sartan. That will allow them to see if the cough will go away, the taste will come back, and we can also not give them additional medications.
That's a great catch, Corey. Good job. Do you understand what he was just talking about? Okay, so the ACE inhibitor that you're on, the lisinopril, has as a side effects of cough and taste disturbances. It's two of the most common side effects, and they don't happen to everybody, but they do happen a lot. Probably the most common out of all of them. So what we often do is try the ACE inhibitor first. When that doesn't work, then we move on to a different medication. In this case, we're going to switch you to something that is very similar in what it does, but it has different, not those side effects, which is the important thing. So the medication that you're on, it works on the converting enzyme for the angiotensin, which affects your blood pressure, basically, raises your blood pressure. So that one kind of inhibits that converting process. The one I'm putting you on is a receptor blocker, so it's going to block those receptors that would normally react to that. So it does the same thing, different mechanism. So we're going to switch you to that, and you shouldn't have any problems with the cough. So we're going to discontinue the lisinopril immediately and put you on the low Sartan. I'm going to write a prescription for that. I want you to take it twice a day, and I'm going to have you come back in 2 weeks. And he is going to answer any questions and give you some education on that medication, okay? Okay, all right. Have a good day.
All right, so just checking in again. The scratch in the Tylenol with codeine. You will not be on an extra medication because you're going to drop the lisinopril, which should help you with the cough and the tasting fairly quickly. You're going to be on the losartan, and you'll come back in a couple weeks.
One more thing, Corey. Forget about the Tylenol with codeine. You won't need that.
Okay.
So we'll have you come back in a couple weeks just to see how everything's going. If between now and then, though, you have a rash, sores in your mouth, sore throat, fever, any sort of swelling, nausea, vomiting, diarrhea, these are all reactions, and you need to come in immediately. We need to know that.
Okay.
So as long as you don't have any of those problems, we'll see you in a couple weeks.
Okay, thank you.
Thank you for joining us for this alternate dimension, the nursing zone.